Hi, everybody, and welcome. Today, I'm really thrilled to have my special guests from Scene Nutrition to talk about their new product chew, the Calcium Chew Plus K2. They're going to answer our questions and talk about some of the science behind this really new and exciting product and why we want to use this, maybe. So we can make good decisions about our bones and our bone health and our calcium intake. If anybody's new here, I'm Dr. Lisa. I'm a physical therapist and a specialist in osteoporosis exercise and the founder of Brickhouse Bones, online programming to support you to stay independent, doing what you love with the people you love. Now, let me introduce. So Scene Nutrition is a women's bone health company creating supplements made from only real food. They formulated the first and only calcium supplement on the market made from real food ingredients for better bioavailability and taste. Now, Dr. Adrienne Batar holds a PhD from Stanford and is a food studies researcher. And Dr. Jennifer Hahn is a board-certified clinical pharmacist with expertise in chronic pain and osteoporosis. And together, they bring food and medicine to innovate food-first supplements. Welcome, Dr. Hahn and Dr. Batar.
Thank you so much for having us.
Thank you.
Well, I really appreciate our conversations, and I just value your food-first approach because that aligns with what I personally do and what I share and teach in my community. I've been using your calcium chew from the very beginning because it really fit in my life. Because here's what I know about me. While I'm well-intentioned and know how much calcium I should get every day, I'm not always good about hitting that target. I can have confidence that this product is easy, it's giving me what I need, and it's made from real food ingredients. I don't have gastrointestinal upset. I can adjust the dosage really simply, and I'm really grateful for it. As are members of my community, I've shared it there, and people have absolutely loved it. So first, I just honestly want to say thank you. Thank you for bringing this product to market to support women and bone health.
Thank you so much, Lisa. That means a lot coming from you. And we've so enjoyed being a part of your Brickhouse Bones community as osteoporosis patients ourselves. We know what your community is going through, and we're learning and sharing just the same.
Yeah, I appreciate that. And your clinical backgrounds really give me the confidence and give them the confidence they need to make good choices too. So this is really great. So tell us about the new product.
Yes, we are thrilled to share with you, Dr. Lisa, and your community the debut of our new product, the Calcium Chew Plus K2. So here's the package. It's the Calcium Chew food first philosophy that you know, love, and appreciate with an important addition. So not only do we have the 500 milligrams of dietary calcium, the 400 I used of vitamin D from mushrooms, but now we have the addition, you can see it here, the 100 micrograms of vitamin K2 from a natural food source, fermented chickpeas.
Fantastic. I know a lot of members of the group were asking, can it contain vitamin K2? So you've made it. I love how you listen to the feedback from people, and I actually think what you did happened very quickly. Can you tell us a little more about vitamin K2? What does it do? Why does it matter?
Yes. So vitamin K2 is super important. It's a fat-soluble vitamin that helps direct the calcium that you consume into your bones. So it does this by activating two really important proteins. The first one is called matrix GLA protein, and the second is called osteocalcin. So when we consume vitamin K2, it activates these two proteins, and it basically helps transport that calcium from the gut to the blood and then to your bone. So we're using that calcium most efficiently.
All right, so K2 is an important transporter. It's like getting on the right train so that the calcium gets to where it needs to go.
Yeah, exactly.
Love it. Okay, so how did you come up with getting a food-based calcium K2, or excuse me, a food-based K2? What's your source?
We sourced our natural vitamin K2 from the fermentation of chickpeas, otherwise known as garbanzo beans. It's a controlled natural fermentation process using the substrate or the foundation of chickpeas, garbanzo beans. So it's an all natural food source consistent with our food first philosophy to bone health nutrition.
That's fascinating. Is it used for anything else, the chickpeas, or is it really primarily to make this vitamin K2?
Just for this vitamin K2. So it's a very pure substance,
Mm-hmm.
and the whole intent is to enhance the bioavailability of that calcium.
Fantastic. Okay, so the addition of K2 that is sourced from real food, from the fermentation, we know that's how K2 is made in fermented products, the fermentation of chickpeas or garbanzo beans. So it continues with your food first philosophy in the product. I love it. So why should I take it? Why should I take the chew with the K2?
Yeah, two important reasons. Vitamin K2 is important, but we know we're not eating enough in our everyday diet. So unfortunately, it's in a lot of foods that's just not common in the common American diet. And so we're not eating enough. But second, we have a strong body of evidence showing that vitamin K2 is extremely beneficial for bone health. So in fact, even going as far back as 2009, the European Food Safety Authority approved a health claim regarding vitamin K2, stating that there's a cause and effect relationship between dietary vitamin K intake and maintaining normal bone. So we have the evidence showing that vitamin K2 is super important for bone health. They're done in peer-reviewed human studies, and so we know that it's helpful. And so now we wanted to bridge that gap of, okay, it's helpful, we're not eating enough. How do we eat enough in a convenient and delicious way?
Yeah, convenient is key for me, right? And tasty. I have tried natto before, and it is an acquired taste. Your calcium chews, I much prefer the taste of that. So essentially, it's difficult for us to really intentionally get enough in our diet, right? To get what we really need. What is the recommendation? What is the amount that we need?
It's a good question. So right now in America, we only have adequate intake recommendations from the Food and Nutrition Board. They're not even RDAs. So what we know, and most of those adequate intakes is based off of vitamin K1, not vitamin K2. So because we don't have that guideline, we have to look at peer-reviewed human studies to get the information of what is a safe dose, what's an effective dose, and then draw conclusions. And so that's why we were intentional about our dose of 100 micrograms of vitamin K2.
Gosh, I appreciate that you do all the work behind that to look at that research and determine what would be most effective.
Yeah.
Great. Is there anyone that should not take vitamin K2?
Yes. So individuals taking a specific blood thinner called warfarin or Coumadin is the brand name, should be really cautious with vitamin K supplementation because vitamin K can impact warfarin's effectiveness. So if you are on that blood thinner, you have to have a conversation with your provider and really clear it before you take vitamin K supplementation. But if you're on a different blood thinner, for example, like there's this whole new category called direct oral anticoagulants. So that could be Eliquis or Xarelto. These medications are not vitamin K dependent, and so vitamin K supplementation should be fine if you're on those specific blood thinners.
I feel like I'm getting personal guidance from my own clinical pharmacist. Thank you. That's really, really helpful. Help people have confidence in what they're doing. So warfarin and Coumadin, it can impact the effectiveness. So they need to talk to their doctor before taking vitamin K2 supplement. But the other one, it's not contraindicated.
Yes, you got it.
Great. All right. What if somebody is taking another supplement? Often they'll take vitamin D with K2 or they'll have another calcium with K2. How should they work that in if they're already using a supplement that has K2 in it?
It's a really good question because we often see the vitamin D and K combo together. And I think we view this as an opportunity to simplify your regimen. Again, we looked at the human studies to determine the safe and effective dose of vitamin K2, and that's 100 micrograms. And you're now getting that all together in one chew. So you can then just simplify your regimen, have one chew, and then continue your standalone vitamin D supplement separately.
Yeah, I appreciate that actually because my vitamin D, it's not often the ratio that I want, and so I could appreciate having just the ratio, that just the vitamin D that I want, and knowing that I'm getting just the amount of K2 that I need with the amount of calcium I need. That is a nice way to simplify that. That's a path I will choose for sure. If somebody's already using your calcium chew, can they swap it out? Is there a way to switch to the new product?
Yes, we know that there are many loyal subscribers in your community, Dr. Lisa, and we have longstanding customers already. So we made it a simple process to swap from the original calcium chew to the calcium chew plus K2. We detailed a FAQ of frequently asked questions on our website outlining the steps. And then we're also available if you want to email us, or we have a phone number you can call us if you run into any trouble.
Yeah, you guys are actually wonderful about that, and I do share the email in the group all the time. And people have said that you actually answer the phone, you actually respond to them, right? Yeah, you're there to really support them and answer their questions, and so I thank you for that. Somebody said, "What should I do if I'm a current customer and I eat 2 chews a day, but I want to switch to the new chew with K2?" So they would be getting twice as much K2.
Good question.
That is a great question. So there's no tolerable upper limit for K2. So it's possible, there's no safety concern with taking 2 K2 chews a day. However, and we also see that using that food first philosophy, we determined that those high K2 sources of food, like natto, like some cheeses, like egg yolks, all combined do provide more than 200 micrograms of K2. So using that sort of dietary guidance, and there's no safety concerns, it's entirely plausible to eat 2 chews a day, 2 K2 chews a day. But what Jenny referred to earlier is that we really relied on the evidence. We looked first at those peer-reviewed human studies, and they found that the safe and effective dose that really made an impact on bone health in these observational studies was around 100 micrograms. So you can either take 2 K2 chews a day, or if you prefer to go based on that robust body of evidence, you could maintain 2 subscriptions, one for the original, one for the K2, and then have an original chew in the morning and a K2 at night. Either pathway is fine.
Great advice. As a food studies researcher, can you say that there's a general agreement that when we get these things from food first, that the safety profile is much higher?
There's been a whole body of scholarship. There's people who have devoted their entire careers to what they call the food matrix effect, which not only studies what they call these ingredients in silos, like supplemental K2, synthetic calcium, but rather understanding all the different cofactors naturally present in foods that help the absorption of those nutrients. So we feel entirely comfortable using this source of K2. And also bear in mind, we're still running nutrition facts. We're still a food company regulated by FDA. We have a scheduled process obtained here through the Center of Excellence for Food and Agriculture in New York. So yes, long answer to a short question.
No, I love it.
Yes, food first all the way, safety profile, bioavailability, all those concerns we feel very comfortable with.
I love that. That's just really that entourage effect of how we take things, like you say, not in a silo, but how it all works together in that system, and that matrix is really where the magic is, right? Can you, do you mind? I love that you showed up the package, and can you give us a little info if somebody's looking at their package and where they find the information about what does it contain? You know, what is the breakdown of the ingredients? People in the community were asking, you know, how do they look for to what the package and see what's on there?
Yeah, so let's do a little tour of our package. So this is the front. A lot of the information that you were just referring to, the nutrition facts ingredients, is going to be on the back. So this is the nutrition facts panel here. And if you look at the bottom, this is where we indicate the amounts. So vitamin D, 10 micrograms or 400 IUs, calcium, 500 milligrams. Vitamin K is listed here. We also list all the other nutrients that are naturally present in these foods because they are important. Like we were just saying, you need the whole orchestra in order to absorb that calcium. So that's all found there. And then the ingredients are listed at the bottom. And you can see it's just 5 simple ingredients. There's no natural flavors or synthetic fillers or proprietary blends. We're just very transparent. This is all from food, and these are our sources.
Fantastic. Fantastic. Thank you. Thank you for making it easy and clear, and so that we know exactly what we're getting and what we're choosing, right, for our bone health.
Yeah.
Okay, so here's the question I really want to know is, how does it taste compared to the original?
We and all of our taste testers agree that it tastes delicious. It has the soft, sort of caramelly flavors of the dates, the milks, the almonds. And I think, and we agree here, and our taste testers agree, that it's absolutely delicious, and it puts the treat back in treatment. Isn't that great?
I love that. That's great. A lot of people have told me that they have to be careful because they enjoy them a little bit too much.
Yeah.
That's great. So similar, same great taste. I have appreciated that too. So that's good to hear. It really didn't change it, maybe even improved it a bit, sounds like.
Yeah.
All right. So I posed the question. I told the Facebook group that I was going to be interviewing, and they asked a whole bunch of questions. We're going to highlight a few of them here. One of them was, is this product gluten-free?
Yes, 100% yes. We actually work with the National Celiac Foundation. 100% our product is gluten-free.
Fantastic. Because we know people with celiac really need to step up their game to protect their bones. So that's really wonderful. Is there a timing that's important in taking this? Is there a special time of day or a schedule that matters?
I know this is a nuance that I try to zoom out on, because I think it's important for us to just get the foundations of nutrients when it comes to bone health. And then if you get lost in the nuance of, do I take calcium with magnesium, or what about phosphorus or oxalates or phytates, it can get really confusing and overwhelming. So we really stick with the foundation that to eat your calcium chew whenever it fits in your routine. Whenever you can remember and it works for you, that's the most important time. We formulated our calcium chew from food, and so it's formulated for optimal absorption. So yes, it has magnesium, and yes, it has phosphorus, but those are the ratios that are naturally found in food, and so we are not concerned about interactions in terms of absorption.
Fantastic. That is, to me, I can't track like that. I can't schedule like that. I need it to be simple and convenient for the same reason. And that's what I teach too, how to, it's more important to get it,
Yeah.
right? Make sure that we're consuming it and getting enough than to obsess about the timing and then feel like we missed a window and then we don't do it at all, right? Yeah. Super. Somebody said, do you know the oxalate count of your chews?
Yes, we've gotten this question before, actually. So we've done this calculation. There is about 1 milligram of oxalate per calcium chew. And so to put that in a frame of reference, if you've had calcium oxalate kidney stones in the past, yes, you should be cautious about external oxalate consumption, but that limit is about 60 milligrams a day. So 1 milligram per chew is far less than the minimum or the maximum amount that you should be consuming in each day. And more than that, the oxalates is combined with dietary calcium from milk. And so the concern about oxalates is not the same as with oxalates and taking synthetic calcium together.
Okay, very good. So even for people who have had calcium oxalate kidney stones, where their upper safety limit is 60, this is just 1. So it's well within the safety profile for that. And it's packaged in a way that is more beneficial to support your natural absorption of the calcium in K2.
Yes.
Fabulous. Okay, thank you for that. That is always a question that comes up. And then we kind of addressed on the last question is that blood thinners other than warfarin or Coumadin, it is still okay to take K2 if you're not on warfarin or Coumadin.
Yeah, like the other direct acting anticoagulants, again, they're not vitamin K dependent. And so it's the concern about external vitamin K is not the same as with warfarin.
All right, wonderful. Well, is there anything else, any other updates or any other information that you want to share with the Brick House Bones community?
It's a good question.
Yeah.
I think that covered really all the basics, but we just want to reiterate that we are part of your community. We truly feel that. And so if anyone has questions, reach out to us, email us, call us. We do answer the phone. We've talked to several Brickhouse Bones community members already, and we'd be happy to have a conversation and chat about it more.
Okay, so for everyone, we're going to put all of that information. It's you can place your order at www.scenenutrition.com. We'll link that below. Don't forget, my discount code is drmore10 to get 10% off your first order. And we'll make sure you have the link to their email and phone number in the comments, the description below the video. Don't hesitate to reach out to them, guys. These guys want to support you. And I just personally want to say thank you for bringing these products to market to support women and our bone health.
Thank you, Lisa.
Thank you for all that you've done in cultivating this community and spreading all of your bone health expertise.
All right. I look forward to our next conversation.
Me too.
Us as well.
If you're new here, I'm Dr. Lisa. I'm a physical therapist and a specialist in osteoporosis and bone health exercise. I do it for myself and I share it with you.